that we have. We have two full in-house full-time cardiologists, and we have also equipped them adequately to be able to meet the functions and their services. Our radiology department also is highly developed in order to meet all the required investigations that we need. We have 4D ultrasound machines, we have a CT scan, we have fluoroscopy, we have mammography. All these are supposed to add to the value of our services so that we don't need to refer people outside of the hospital in order to meet some of these basic and advanced, relatively advanced investigations, including our laboratory. In actual fact, we used to have Zankli Research Lab here, which was one of the renowned centers for investigating tuberculosis. And this is in collaboration with some other agents, such as London School of Liverpool School of Tropical Medicine. They sent experts here to come and train and do research here. We also collaborate with the National Tuberculosis and Leprosy Service of Federal Ministry of Health, and we are engaged in the Stop TB program nationwide, and we have collaboration with other agents outside the country. These are some of the things we are doing. One other one is SCORE. This sickle cell disease cohort study, research study. Sickle cell disease is prevalent amongst us, the blacks. So we here in Zankli, we are also into the research into how to investigate and to treat, and also to teach the caregivers the best way to manage this group of people. And we have, in our collaboration with one other group called Arise, we are collaborating with people abroad, Europe, European countries, and we have been sending our staff, radiologists, pediatricians, nurses, in order to know how to detect this disease in neonatals as soon as they are born, and how to manage them all through. These are some of the services that we are rendering. I must say, in all fields, including surgery, pediatrics, internal medicine, gynecology. We have 2 gynecologists, for instance, and now we have, in order to empower them the more, we have laparoscope in order for them to be able to do minimal invasive surgery, so that they will not need to cut open their patients in all cases. We in the private practice, we are suffering from the heavy burden of multiple taxation from the government, ranging from things like the company income tax. We believe that people who are rendering this kind of service should have some rebates, even if the government itself, even if it's funding some of these, some of the programs that we are doing, to help us in order to be able to do, in order to put our resources in improving our lot. We have Abuja Municipal Council, we have Abuja Environmental Sanitation Protection Board, we have things like radio licensing, advertisement, company registration, premises registration, and some of these services are already being taken up by the Federal Capital Territory Administration body, which the Abuja Municipal Council is also wanting for us to be also paying them for. We believe the government can help the private sector a lot by reviewing some of these taxation and even giving exemptions to these private services, for we are rendering humanitarian services to the population. Not only that, we are also involved in a lot of community social responsibilities. Some of these, for instance, we have a non-profiting organization called SUCO, in which is involved in research into infectious diseases and also giving free treatment to some of the poor who cannot afford this. And we're also involved also in research with this. Some of these are ways that we want to even give room, allow people who really cannot afford our services to be able to reach it, because as far as we are concerned, we want to reach out to as many people in the population as possible. But we need to remain afloat. We need to be able to pay the salaries of the people who we are engaging, because we have like 200 members of staff in this hospital, and it's not easy maintaining all this on full-time employment and paying them and keeping them. I want to tell you that we have some staff who have been here for more than 15 years, and they have been serving, and they are happy staying. And we encourage a lot of people. The only people who live here are some who probably have to leave the country to come and, for either they are going with their husbands or family, or those who have got jobs in the federal government, with the federal government. Otherwise, a lot of people are just satisfied with the way the services have been run, and our human resource management is treating them. On the last note, the season in which we are, the pandemic of COVID-19 is very real, and we have had very prominent people who have been affected. It's not a disease for the rich only. Now, even the poor, because it is now a community disease. Community spread is quite prominent, and the major way to handle this is by personal hygiene and modifying our ways of life, distancing, social distancing, and also by way of obeying the isolation, the lockdown, whatever the government has asked us to do, in order to reduce moving around, because our moving around is what carries this virus to places. It will help to reduce the load, the burden of the disease on the health system until we are able to overcome it. By God's grace, we hope the vaccine will soon be available, and that will help in a long way to bring to an end the pandemic that we are seeing right now. Let's support the government. The government is doing all it can. It's overwhelming for the government. Whatever support we can give individually, corporate organization, citizens of this nation, I think we should give it to the government.